it's not just a single cancer. Now, when I was in the military, we saw like 20-year-old guys. What do they get? If they're going to show up with cancers like testicular cancer, they get a lump in their testicle, boom, go to the urologist, done deal. That's most of the time. Or it's a single, right, and they also don't show up with multiple mets all over the body. But that's what we're seeing. Now, why do we see that now? Because another dirty little secret that's come out in all this is that we've been ignoring the issue of parasites and cancer. The NIH is not, because they've got 1 million studies on ivermectin and cancer. But doctors all over the world now are showing videos, and there was a German research project years ago in the 90s, I think, showing cancer was parasites, intracellular parasites. Right. If you look at a cancer metastasis, like or an adenocarcinoma of the bowel, for example, or breast cancer under the light microscope, it's essentially indistinguishable from these parasite egg sacs. Now, Brian Ardis, who's a chiropractor but very interested and very good researcher on this stuff, he said he has a friend who's a 40-year Egyptian parasitologist. And he asked him, and he pointed this out to him. He said, hey, I've been looking at this cancer and versus the parasite egg sacs, and they look identical under the microscope. And this guy got real wide-eyed and said, in 40 years in parasitology, not one oncologist has made that association, but we talk about it all the time in parasitology circles. I translate it as saying, they know that cancer is parasites. They're not speaking because they don't want to lose their funding. That's my translation of that. So that's what's, I think, going on, and that explains why. So here you got these young military guys. Let's say they're from Fort Bragg, they're Rangers or something. They've been out snooping and pooping in the brush. They've been to Afghanistan. They've picked up, they've been eating dirty food. They've been eating all sorts. So they probably have parasites, right? But they've been healthy because their immune system's been strong. And so what happens is when you take in a parasite, you have a mother parasite, and these can be microscopic. They're not something that always show up in the bowel, but you can have macroscopic and microscopic parasites. So you take these things in, and the mother parasite lays between 20,000 and 200,000 eggs a day. Many of those eggs pass out through your feces, but a lot of them stay in the body and become encysted. They just get walled off in your muscle, your brain, your liver. And your body, when you're young, you're 15, 20 years old, you've got parasites, you encysted these things, and you've got sentries, these toll-like receptors in your body. The immune system is keeping them in check. Well, now we give you a vaccine that drops out that immune system, and what happens? They all start growing all at once. And, that is the problem. And I think that's what we're seeing when we see these young guys come in. So there's a treatment for that. It's called fenbendazole. And we have lots of treatments. So the answer here is probably for both the synthetic parasite and the your intrinsic parasite is parasite protocol. I just made a Rumble video.
But one thing about that too is, certainly the ranger who went to some faraway place and got some weird zebra-like parasite, but we're seeing parasites in people who live in America, a first world country with clean bottled water and all this. We're still getting exposed to parasites every day.
Exactly. Right. If you have dogs, you have parasites. If you have cats, you have parasites, maybe. People, we were told, and I'm going to tell you, this was purposeful. Don't think this is by accident, that we just weren't, paying attention. No, they were paying attention, and they purposely did things to make it so we weren't looking. The joke in medicine, WNL, is supposed to be it's within normal limits, but it really means we never looked. They told us that parasites were the third world country. They knew better. Anybody, you can't tell me all these people in the universities and all the smart guys in research at the NIH and all over the world weren't paying attention to parasites or these other things. Secondly, when I was in medical school, I went to the University of Rochester in 1976 to 80. During that period of time, we were taught, always look at the patient's fresh blood yourself. Don't just send the blood to the lab. You know what? By 1985, they were telling my colleagues that are just slightly younger than I am, saying, no, that's just nonsense. Don't look at fresh blood. And now they make fun of people like these nurses these holistic doctors that look at fresh blood. They say that's just nonsense what they're talking about. No, that's what the German researchers started seeing in their cancer patients. They started seeing these. They said every one of these cancer patients has parasites. I'll tell you another one, talking about acquiring parasites. I remember that when when I was, again, this is back in 1977 or 78 when I was in medical school, hearing a lecture on multiple sclerosis, and they were talking about one of the risk factors. One of the risk factors of multiple sclerosis was having a lap dog at a young age. I thought, well, that's kind of weird. Why would that matter? Okay, because they don't know. They thought it was some kind of autoimmune disease, right? Dr. McDonald, a pathologist, apparently, I think he's in Florida, he did a series of autopsies on MS patients, and 100% of them had parasites in the brain and spinal cord. Okay, so MS is also not a Dr. McDonald, Florida, pathologist, and he said he did autopsies on multiple sclerosis patients, 10 of them that died over the period of time he was in practice doing autopsies. 10 patients, 100% of them had parasites in the brain and spinal cord. Now, how do we make the diagnosis of MS? We do an MRI, and you've got neurologic symptoms, and we see on MRI in your brain and in your spinal cord, because this is a central nervous system problem, we see what we call plaques. But remember, plaques are just a term. It doesn't tell you etiology. When we look at an MRI, it's based on the amount of fluid in the tissue and if the fluid is moving or not. It's that simple. So these things are just some kind of different fluid from the surrounding tissue. It's parasites. So, cancer, and we see all these, on the MRI, you see all these spots, white or black, depending on the weighted image, all over the body. Well, we've got a paradigm that we see, oh, that can only be cancer when we see it like that. If we're starting to think about what else could cause things all over the body, parasites could. And now, you might be a little young to remember George Carlin, but you remember George Carlin, the 7 words you can't say on TV? Most people know that comedy routine. He had these, the bad words you couldn't say on TV. Well, now you can say them all. Okay. Yeah. Yeah. Right. Get your button ready. I'm not going to say those. Oh, but you might have to censor the 6 words you now can't say on TV. And those 6 words are, right? They don't want us to know about these: nitazoxanide, chloroquine, hydroxychloroquine, ivermectin, fenbendazole, and chlorine dioxide. Those are the 6 words. They're all anti-parasitic drugs.